Pregnyl. In your Pregnyl package you will find 1 ampule of sterile water and a very similar looking ampule with dry powder containing 5,000 units of Pregnyl which have to be refrigerated until use. Mix your medication shortly before injection with the help of one of the 2mm syringes that you have been handed out together with your medication. In your bag of needles you will find large pink or orange mixing needles and small grey injection needles. Twist the yellow or pink mixing needle on the syringe and remove the needle cover. Take the ampule of sterile water into your hands and check if there's any liquid in the head of the ampule. If so, snip the neck of the ampule a couple of times with your fingers so that the liquid slides down. Place your thumb on the indication point of the ampule neck and break off the head with a fast backwards movement of your hand. Use a tissue to prevent cutting yourself. With the ampule of water on a flat surface, insert the needle and pull back the plunger until the syringe fills with the total content. It makes it easier to hold the ampule slightly at an angle. Break the neck of the ampule with the dry powder in the same way. Slowly inject the water that you have just filled into the syringe into the ampule. The powder will immediately dissolve in the liquid. To remove any leftover powder sticking to the glass walls, gently swirl, don't shake. Keeping the needle in the ampule, invert it and slowly pull back the plunger until the syringe fills with the total contents. Now you have prepared a dose of 5,000 units of Pregnyl. In many cases your dosage will be 10,000 units. To reach the higher dosage, open another package of Pregnyl, take out the ampule with the dry powder and dissolve the powder with the solution of 5,000 units you have already prepared before. Slowly pull back the plunger until the syringe fills with the total contents again. Now you have prepared a dose of 10,000 units of Pregnyl. Detach pink or orange mixing needle and exchange with the grey injection needle. Remove any air bubbles from the liquid before you inject. Hold the syringe in the air with the tip of the needle showing upwards and gently tap it with your finger to let any air bubbles rise to the top. Slowly push the plunger until a few drops of the liquid appear at the needle tip. Pregnyl is injected under the skin of the abdomen, even though you will find only the recommendation for an intramuscular injection in the package insert. Gently squeeze the skin around the injection site with one hand about handle wide from the navel. With the other hand, clean the injection site using a fresh alcohol swab and let the skin air dry for about 1 minute. Take the syringe into your hand and quickly push the needle into the skin in a 30-degree angle. Depress the plunger in a slow, steady motion, and when all medication is injected, count to 5 until you remove the needle. Using a clean alcohol swab, apply pressure on the injection site if there is minor bleeding or discharge. Pregnyl has to be injected at the exact hour that can be found in your stimulation protocol. Please don't change the injection time by yourself.